Good morning. Good morning. And thank you, Linda. I'm delighted to be here this morning to welcome you all to this year's BARDA Industry Day. We are at a pivotal moment as we emerge from the COVID-19 pandemic. We have an opportunity for the first time in nearly 4 years to lift our heads up and look out and make sure that we are properly preparing for whatever comes next. Your partnership in this next phase of preparedness is critical. I anticipate we will have lots of challenging conversations about the future of medical countermeasures. What's in, what's out, what's next? And we won't be able to do this without you. But first, let me take a step back. For those of you that might not be as familiar with ASPR, though Linda just helped me out here, our mission is to help the country prepare for, respond to, and recover from public health emergencies and disasters. And BARDA is a critical component of ASPR, one of the premier science and research institutions within the federal government, leading the advanced research and development of medical countermeasures, and an important part of the ASPR medical countermeasure continuum. To date, BARDA has supported the advanced research and development and licensure of at least 84 individual countermeasures, with more on the way. I had to confirm that with Gary because they're moving fast, you guys. And these countermeasures, as you all know, don't develop themselves. BARDA has to partner with many of you in the private sector, which is why it is important that we bring innovators together, as we are doing here today, to ensure we have the right technologies, the right platforms, the right processes in place to counter the threats we see now, as well as those we don't see yet, but know are lurking just over the horizon. And it is clear that you all understand the importance of this work, as BARDA Industry Day, now that it is in a hybrid format, has participation from nearly every corner of the globe. The popularity of this meeting is a reflection of the exceptional leadership of Gary and Linda and the tireless work of the whole BARDA team. You can tell I'm proud. At ASPR, we learned a lot during the COVID-19 response, and one of those things we learned was how important it was to have an end-to-end countermeasure continuum. It wasn't enough just to have the research and development capabilities that BARDA so expertly provided. We also needed supply chain investments, procurement and distribution expertise, as well as the ability to stockpile countermeasures that we would not use immediately. Over the course of the pandemic, we set about building these capabilities within ASPR, so we will never be without them again. Using the BARDA public-private partnership model, we've established our industrial base management and supply chain office, an effort to invest in the public health supply chain by supporting the domestic industrial base expansion, the domestic manufacturing of critical medical supplies and PPE. Partnering with industry, we've invested over $17 billion in 87 different projects to support the domestic manufacturing of these critical materials and supplies. Many of these materials are important for the development work that BARDA is leading and will guarantee that they are domestically available if we ever see supply chain pinches similar to those we saw in early 2020. We have also built in-house the operational and logistical expertise that DoD brought to Operation Warp Speed. We now have HCORE, our own operations and logistics element that builds on many of the lessons we learned from DoD to ensure that the countermeasures BARDA develops can be quickly distributed to the people and places that need them. And finally, we have the Strategic National Stockpile for those countermeasures BARDA develops that are not deployed immediately. Right before the COVID-19 pandemic, the Strategic National Stockpile was moved from CDC to ASPR. Having the ability to stockpile for future use the countermeasures that BARDA develops is critical to our preparedness and response framework. I am pleased that we have been able to build this end-to-end medical countermeasures continuum within ASPR, one that ensures we have the availability of the materials needed to develop countermeasures, the expertise to support the development of those countermeasures, the logistical know-how to quickly procure and distribute those countermeasures, and finally, a place to store those countermeasures. And now that we have these capabilities covered, we must decide which threats to prepare for and which countermeasures to invest in. To help answer these questions and to further strengthen ASPR's response efforts, I reconvened the FEMC in early 2022. The FEMC consists of departments and agencies from across the U.S. government with equities and medical countermeasures. And I've asked them to work with me to make sure we have the right countermeasures against the right threats in the right amounts. The FEMC members have spent a lot of time with our intelligence community colleagues over the last year as they seek to answer this question and to help us prioritize. The FEMC has also met with industry partners directly over the last year to receive feedback on medical countermeasure programs, federal government coordination, as well as to hear the unique industry perspectives on emerging technologies. I think it's important that our countermeasure efforts evolve and adjust to prepare for an increasingly more complex threat landscape. We need to continue to explore new technologies and platforms. We do not want to be caught preparing for the last response. We need to prepare for what will come next. Fortunately, BARDA, ever on the cutting edge, has started expanding beyond its historical approach of one bug, one drug, and is working on a suite of threat-agnostic countermeasures. So we have tools to treat the impacts, the injury caused by a threat, regardless of what that threat is. Staying a step ahead of these threats requires close coordination with you, our partners. We understand that building a stronger, more agile system of preparedness means working closely with many of you. Together, we have made significant strides in keeping Americans safer, better prepared, and more resilient in the face of public health emergencies and disasters. I want to extend my deepest appreciation to each of you, the companies, the organizations, and individuals who have brought your technologies to BARDA for consideration. We couldn't do this work without you. Thank you for being such terrific partners. I hope your meetings and conversations over these next few days are productive, and thanks again for joining us.